Today, I'm Jamila Mantal and I'm going to demonstrate the physical assessment on how to perform it. First, in taking the health history, start your assessment by taking a detailed health history to obtain subjective data. The information you gather during the interview will provide insight into the patient's actual or potential health problems and guide your physical assessment. Don't forget to perform the proper hand hygiene. Next, provide privacy. And the next step is prepare all the materials needed. And this is the materials needed. To make the patient feel comfortable and respected, begin with open-ended questions. Requires yes or no answers only. Ma'am, can I ask, do you smoke? No. Okay. Also, note the patient's level of consciousness, including his degree of wakefulness and orientation to person and place and time. After obtaining the health history, ask the patient to empty his or her bladder and provide a urine specimen, if needed, and put on a gown. First, we're going to assess the patient head and face and inspect the head and face. They should be normal in size, shape, symmetry, and contour. Next, look at the patient's hair and note its distribution, quantity, texture, and color. The hair should be not extremely dry or oily and should not contain scales or meats. Next, palpate the patient's scalp. Next, palpate the patient's scalp, which should be pink, mobile, and free of lesions. You may feel bony prominences in the forehead, in the sides of the parietal bores, and behind the ears. These are normal. Using the tips of your middle finger and index finger, palpate the temporal arteries. Their pulsatory should be feel equal. Listen for bruise over the temporal arteries. You should not clear any. Balik ka daw, naluloko ko sa'yo. Using the tips of your middle finger and index finger, palpate the temporal arteries. Their pulsatory should be equal. Listen for bruise over the temporal arteries. You should not hear any.
Kuwan.
Ika na.
Next, press your thumbs under the inner aspect of the orbits and then palpate frontal sinuses and press under the zygomatic bores to palpate the maxillary sinuses. Lightly percuss these areas. Palpating and percussing the sinuses should not cause pain or tenderness if they do assess the sinuses further with transillumination.
Wait, go.
Move your fingers to the patient temporomandibular joints as you palpate with your middle fingers. Then instruct the patient to open and close his mouth too. Open your mouth. Close. Open. The joint should have freely and painlessly. This technique assesses joint mobility and the joint should have freely and painlessly. This technique assesses joint mobility and the motor. This technique assesses joint mobility and the motor function of the trigeminal nerves. To test facial muscles and the motor portion of the facial and trigeminal nerves, have the patient raise and lower his eyebrows, bare his teeth, smile broadly, puff out his cheeks, and keep his mouth closed as you try to open. All of this movement should be symmetrical. And keep his mouth closed as you try to open. All of this movement should be symmetrical. If the patient reported problems with his sense of taste during the health history interview, test the sensory portion of the facial nerve. Doing the identity sweet, sour, bitter, and salty substances. Salt to assess the sensory portion, the trigeminal nerve. Test the patient ability to identify simple touch. Instruct him to close his eyes. Mom, please close your eyes. And to tell you the moment he feels something touching his skin, check for simple touch sensation both sides of the patient's forehead, cheeks, and jaw.
Right head, left cheek, right cheek.
The patient should feel the sensations equally on either side of his face.